So coming to the third question, what are the factors basically induce this? There are a lot of basically pathophysiological situation I'm going to mention. Number one, colitis, colon polyps or colon cancer, then IBS, diverticular disease, hemorrhoid, anal fissure. I believe that all these things are connected to the nutrition. So it would be very much beneficial for all the viewers if you can just go on and just clarify all these pathophysiological situation that why does it happen basically.
Yeah, I mean, it's a good point you make. And I think I agree with you. A lot of those conditions, we've got to classify them as metabolic conditions. So autoimmunity is a very complicated thing. So things like colitis and Crohn's disease, we've probably got an issue with the mitochondria. It's a lot more complicated and multifactorial than that. But the fundamental issue is mitochondrial health. Okay, these mitochondria are little batteries within the cells, and I think these things are dysregulated. So the way we view things is that we classify them as separate diseases, but they're all probably one and the same modern day illness. Okay, and all brought about by just the way our environment is now, not just the food environment, but just our general environment and our lack of ability to exercise and things like that. And we're surrounded by chemicals of various forms. So constantly the system's under threat. So these diseases that you mentioned are basically, you've got to classify them as modern illnesses, right? Modern metabolic illnesses.
Right. So what is the basic, what would be your basic recommendation to cure this modern illnesses, so-called, what do I believe that there is something which is wrong basically in the nutrition part, well, especially in the India, if you see people are so much into carbohydrates and 80 to 90% of every meal constitute of carbohydrates only, and there is a deficiency of protein. So, do you agree with that fact that it's happening because something is wrong completely in the nutrition paradigm, isn't it?
Yeah. Unfortunately, the subcontinent, Bangladesh, Pakistan, India, Sri Lanka, they've got a big problem. There's a huge reliance on plant-based protein. Okay, the problem with plant-based protein, it is just less digestible. It's got a lot more anti-nutrient factors. So essentially, the ability for plant-based protein to stimulate muscle protein synthesis is very, very low, as you will know.
Right.
So if the ability to hold on to quality muscle is diminishing with time, and it often starts from the third decade of life, you've then got an issue, because if you're eating a whole heap of carbohydrate with diminishing muscle mass, you've just got nowhere to burn it. So it is such a metabolically active tissue, the muscle. And so this is what diabetes is. It's essentially excess energy in the setting of low muscle quality.
Yeah, I would like to, congratulate for your upcoming venture, of course, as you mentioned, the diabetes, basically, for the Defeat Diabetes project that you just uploaded just yesterday. I really congratulate, best wishes from my side that you are one of the members of the medical advisory panel of that particular Defeat Diabetes Australia-based program. It's really great, the remission of diabetes and pre-diabetes with the use of real nutrition.
Thank you very much. Yeah, look, we're all very excited, and credit has to go towards Dr. Paul Mason, who you may know is very prominent in the low carb world, and Dr. Peter Bruckner as well. Very, very prominent names, and credit has to go to them for developing the app. And I'm very excited to be on the medical advisory panel there, along with a few brilliant doctors in the low carbohydrate scene. But I'm very proud of Australia that we've been very progressive in this low carb world, and I hope the same happens to India, because I do know that the burden of diabetes in India is it's enormous. It's enormous, and compared globally, even though America's got the obesity problem and the issues with their metabolic health, India's diabetes epidemic is unprecedented, along with China, and other Asian countries.
I hope that this kind of project may start soon in India also, because people need this kind of awareness, this kind of projects in India to have a better lifestyle. I believe that too. I really agree with you Pran. Okay, so my next question is carbohydrate, specifically fibers, are important to cure constipation, or it's just something else where we need to focus?
Look, fiber is a really controversial topic. Fiber certainly will increase stool bulk. And if something increases stool bulk, it generally should increase transit time. So people find when they eat a lot of fiber that they tend to create more stool bulk and they tend to be more regular. But is it critical for the bowel to move? No. I mean, there's been plenty of meta-analyses done in children and published in very, very sort of high-ranking journals, which show that sometimes addition of fiber to children that are constipated can paradoxically constipate them even more. And sometimes what is recommended is an elimination of the dietary fiber to help alleviate their issues. So it's not a matter of one size fits all, but carbohydrate or fiber, which is a form of non-digestible carbohydrate, is not really something a human can utilize. What tends to occur is once the fiber reaches the hindgut or the colon, the bacteria that exist in the colon digest these fibers, okay? And they release something called short-chain fatty acids, of which one is butyrate. Now, butyrate is a fuel for the colon, right? So what is fermented creates the short-chain fatty acids, which then nourishes the colon locally in that area. Okay. But there's better ways to do it. And I've always argued the point that having a systemic ketosis, bringing your own levels of beta-hydroxybutyrate, which is a very similar molecule to the butyrate, is far more efficient to nourish both the small bowel and the large intestine through systemic circulation, through your own bloodstream, rather than locally by fermenting the fiber. The byproduct of the fermentation is methane, hydrogen, and nitrogen, which are very, very, some people just don't tolerate these gases very well. They get bloated, they can get issues with gut motility, they can get belching, lots of gas production, and they can make them very uncomfortable.
Right. I really agree. Means like, you're completely true. Means like in this situation particularly, a lot of people take fibers, and a lot of people, even after taking fibers, they do not get rid of constipation properly. They become really confused with that particular thing. So that is what it means like the situation happens. You very much clarified it very well. Okay, so my next question is why, after intermittent fasting, consumption of sugar or carbohydrate meal causes inflammation, but protein meal does not? Means like this is the something which I have faced personally very, very well. Why does it happen?
Why does sugar cause inflammation?
Means like suppose a person is doing intermittent fasting after a long period of gap. If that person is actually having carbohydrate or something sugary based meal, the second that the person is taking, some kind of inflammation or pain or some kind of discomfortness happens. But if that person is taking some protein meal, that time it doesn't happen. Why this kind of difference happens in our overall digestive system? What is the real cause behind it?
It depends on the carbohydrate, of course, but there are many carbohydrates that we consume that contain non-digestible carbohydrates, right? So an onion or a garlic or a cereal or a grain-based food or a chapati, for instance, these might be very rich in a sugar called fructan, right? They might contain simple starch. Starch is easy for the system to absorb. It's, we start breaking down starch in our own mouth. We've got salivary amylase, which starts breaking it down immediately. But the other type of sugars, like the fructans, we struggle to break them down. So as a result, they've got to move into the lower colon where the bacteria can ferment it for butyrate, right? And as I said before, the butyrate comes with its gases, nitrogen, hydrogen, methane, and these are very uncomfortable for people, okay? So that's the issue. Simple sugars in themselves are not the issue. I mean, it is if you're a diabetic or metabolically unhealthy, but someone like yourself, if you were to consume a simple sugar, your muscles would soak that up because you're a very well muscled man. Now, if you're a diabetic and you're consuming sugar, there is poor quality muscle. The sugars will, the blood sugar will rise concurrently, the insulin goes up. So these people get very erratic sugars, but someone like yourself, it's not an issue. It is more a question of the non-digestible carbohydrates. the fructans, the fructose, the lactose, the polyols you're found in nuts, you know, legumes. There's a whole host of these foods in nature that are problematic. And unfortunately, they're so prevalent in the subcontinental diet.
Yeah,
Things
but
like
because I have faced it personally. Because the moment after doing fasting, if sometime it happened with me, like I just had a high carbohydrate meal, something like grains, basically rice or white rice, and suddenly my entire digestive system gets flooded with some gastric issues, inflammation and pain, discomfortness. So, but if I have some
yep.
protein meal, suppose I'm having paneer or chicken breast or something like that, I really do not feel anything. It's like after fast also, I really feel comfortable after a
Yeah,
long gap. Also, even if I'm intaking some meal or high protein meal, so that is what actually
see,
I feel.
the digestion occurs at the level of the stomach and the proximal upper gut. It's, you know, we do it very efficiently. We do it through the proteolytic enzymes. We do it through lipases that break down fat. We do it through stomach acid, and we're very efficient at it. It is what we're built for.
Right.